Welcome, everyone. Thank you for joining us today for this webinar on e-cigarettes and vaping, a safer alternative or a public health risk. My name is Jared Kavanaugh. I'm a clinical toxicology fellow at the Georgia Poison Center. Regarding this presentation, I have nothing to disclose. This educational activity has been approved for 1 CE hour for nursing, as long as you watch the video live and then follow a survey at the end of this, which will be emailed out afterwards. So the objectives for today's presentation is to describe the trends in electronic cigarette use, marketing, and legislation, to recognize the safety risks of e-cigarettes, identify signs of vaping-associated acute lung injury, and to evaluate the emerging evidence on the public health impact of vaping. So tobacco is a plant native to tropical and subtropical America and is now cultivated worldwide. It's grown into a very large $785 billion industry, and it's the leading cause of preventable death in the United States, with over 480,000 deaths yearly. This shows a breakdown of the deaths associated with tobacco use. Interestingly, over 437,000 of this is due to the individuals who are directly smoking cigarettes. However, the remaining about 43,000 is those who are not smoking cigarettes. So this is due to prenatal and sudden infant death, to residential fires, and then a large amount due to secondhand smoke-related diseases. So smoke particles are carry nicotine into the lungs during combustible cigarette use, and the nicotine is quickly absorbed into the lungs and transported to the brain. Nicotine then releases dopamine and other neurotransmitters, causing pleasure and stimulation. This is a cycle of the addiction and dependence that's shown on the screen here. Starting from the left-hand side, various cravings cause a cigarette user to want to smoke. These cravings can be due to nicotine withdrawal symptoms and also just due to smoking cues or stress. So oftentimes, cigarette users wake up in the morning and would have a cup of coffee and their cigarette with that, or a cigarette on the drive into work. And so regardless of the level of nicotine in their system, they may not be having any signs of nicotine withdrawal, but just the action of driving into work may prompt them to smoke a cigarette. So they smoke the cigarette and there's a spike in nicotine, which activates these nicotinic cholinergic receptors in the brain. These receptors then release dopamine, which causes pleasure and stimulation, and then again will reinforce the behavior that's occurring at the time of smoking. So this, again, if the person's smoking while they're drinking their cup of coffee, it will then reinforce that behavior to then prompt a cigarette smoke when they're had their next cup of coffee. Moving on to the right-hand side, as these receptors are activated, they then become deactivated as the nicotine levels drop in the system. And depending on how addicted the person is to nicotine, that can cause withdrawal symptoms, which then stimulate further cravings. And this is a very addictive cycle, and it's very hard to break. And despite over 70% of people who currently use combustible cigarettes having some desire to quit, only 3% are successful each year. So entering e-cigarettes. So if we have a large portion of these deaths due to tobacco, and the tobacco is the main cause of disease in these individuals, we can then substitute this for just a pure nicotine product, which then can help deal with the cravings for the individual, but without the big, large risk of disease. E-cigarettes also are unique in that they can help with some of the social cues that prompt cigarette use as well the individual can, while driving, have the same hand-to-mouth motion that they do with the cigarette use. So the first patent approved for e-cigarettes was back in 1965 and was just a rough approximation of what we have today. And in 2003, a Chinese pharmacist developed the e-cigarette as we know it now. In 2006, this was imported into the United States. They're known by many different names, e-cigs, cigalikes, vape pens, hookah sticks, and then electronic nicotine delivery systems, or what's commonly referred to by the FDA and other organizations. Universally, these use a battery-powered coil to heat liquid into an aerosol, and this is in contrast to some other type of vaporizers, which are heat not burn, which utilize dry tobacco or often marijuana and then heat that but not burn it. We won't be discussing those as much today. And the changes in e-cigarette appearance and function have developed as they've gone through these different generations of products. Shown on the screen here are the various e-cigarette products that are available or have been available over the past few years. Starting on the left-hand side, we have the first generation products, commonly referred to as cigalikes. These were the first ones implemented, and they were meant to look like cigarettes. They were disposable. They featured a closed system in which the nicotine was in a cartridge inside of this. And these frequently had a light at the end which illuminated via breath action and showed that the device was heating and working. Moving further over to the right, the black and yellow pen there kind of in the center, this is typical of the second generation product. These products improved the device battery. These were now rechargeable. Oftentimes they're not disposable. And they had the tank system, which was able to be refilled with different products of nicotine. These then use a button to activate the system for the most part, and so that they were not breath activated. Moving further over to close to the third generation products, the boxy e-cigarette in the middle there, commonly referred to as mods. These were called this because they were heavily modifiable and that they had very large batteries. You could replace pretty much all portions of the e-cigarette to customize use. And these, again, had a higher nicotine delivery because of the larger battery and then improvement in the functions. There's also some more novelty agents, e-cigars and e-pipes. And then down at the bottom, are commonly referred to as the pod type systems, where they have these USB-looking devices where there's the pod, which is the mouthpiece, and the the nicotine itself is replaceable through there. So moving on to e-cigarette use in children, recent surveys have been done in high schools and middle schools in 2018, and have showed that 20.8% currently use e-cigarettes. And it's important to realize what these percentages are when they're saying currently use. In most of these surveys, they're taking anyone who's used at least once in the last 30 days. And then 5.6% of these people frequently use e-cigarettes, which is defined as greater than 20 out of the last 30 days. Looking at the graph here, the bold black line at the top is all tobacco products in high school. And then the dashed black line is e-cigarette use. And so despite e-cigarettes being introduced back in 2006, even as far as 2011, there was a very low percentage of use. Moving into 2013 to 2015, we saw a huge spike, and which actually drove tobacco product use. And then between 2015 and 2016, there was further legislation passed which limited the access of youth to get e-cigarettes, which may be attributed to the drop. And then 2017 to 2018, we've again seen a large spike, and it's probably only gone up from there. This is in contrast to adult use of e-cigarettes, which is only about 3.2% of all adults that are using them, and about 18% use combustible cigarettes. So the reason that we care about e-cigarette use in minors is because these individuals are more at risk for the adverse effects of nicotine. The brain is still developing through puberty especially, and even up to the age of 25, and these individuals are more at risk for the adverse effects of nicotine. So they experience increased pleasure because while the dopamine and the pleasure pathways in the brain are developing, they're further developed than those that are involved in decision making. So they are often not able to understand the risks of using e-cigarettes and nicotine and addiction, as well as they're more susceptible to peer pressure. In addition, adolescents have decreased withdrawal sensations, but increased pleasure with e-cigarettes. And all of these combined lead to a lower threshold for addiction, as well as them not understanding the severity of addiction. And this has been linked with mood disorders and impulsivity, such as ADHD, later in life. So it's important to understand the motivation behind youth vaping. So there was a survey done of 5,400 adolescents and young adults from various ages, and this was to determine the top reasons for e-cigarette experimentation and discontinuation. In those surveyed, the main reason was curiosity, and individuals were allowed to select more than one, which is why this percent is greater than 100%. But the main reason was for curiosity, The second reason of over 40% said the availability of appealing flavors drove their use for e-cigarettes, and so just under a third had their friends' influence or peer pressure. Reasons behind discontinuation was 23%, the largest percent was other, and this was mostly people writing in stuff as I only used it once and didn't enjoy it, or I had a one-time use and it just wasn't for me. 16% said that it was uncool, and only 12% were concerned about the health risks. Now, this is again in contrast to adult reasons behind experimentation, which curiosity was again the top reason in adults wanting to try e-cigarettes. The second was friends or family influence, and then the third was to stop smoking. And quite a few of them said discontinuation was the taste of the cigarettes that they didn't, or the e-cigarettes they didn't enjoy, and a large portion said that they just didn't get the same satisfaction out of an e-cigarette than they did. So there's marketing has been a big push in e-cigarette industry, and there's been a lot of regulation in regards to that. So oftentimes the flavors are associated with a lot of people thinking that this is targeted at younger children, and there is a large variety of flavors. So a recent survey found that there was over 7,000 different flavors available. And this can be potentially younger individuals are wanting to use e-cigarettes because of the flavors. This is also dangerous because of the sweet smell might be attractive to even younger individuals, such as children and toddlers, who might inadvertently drink the product. As far as packaging, there's been some restrictions made on this. There oftentimes in the poison center world, we're very familiar with medications that look like candies and can be a motivation for children to get into them. And here we see some instances of products that are clearly marketed to look like those that are commonly available as foods or candies. These devices or these products here have been removed from the market after the FDA sent some warning letters out. But again, just show kind of the marketing has been potentially marketed towards younger individuals. In addition, there's been vaping expositions, which the FDA has then kind of directed some regulation towards stopping this as well. These are typically done to market products and show the different amounts of products that are available. But there have been instances where people are giving out samples during this, and sometimes the samples are actual pieces of candy that are supposed to taste like the e-cigarette flavor itself. And so there's been a stop to allowing samples to be given out. In addition, despite some of these expositions saying that they need to be 18 or older to enter, there was one journalist who did an article and saying that there was no type of age restriction that was actually in place other than just saying 18 or older must be available. And there was no ID check at either time of purchase or time of entry to the exposition. And then social media has also been a large portion of marketing that are potentially directed at younger individuals. So the number of tweets is shown on the graph here for Juul-related products from 2015 to 2017. And we see just a huge spike in the last couple of years of this survey as far as the amount of Twitter posts. In addition to this being the potential markets where a large amount of young people are getting access to these advertisements, there's also been some controversy regarding paid advertisements of Instagram and other social media influencers who have a large market share of their followers are those below the age of 18. So the FDA has taken action as far as e-cigarettes and vaping, and there's probably only more action to be taken as we're becoming more aware of these risks. In 2016, the FDA was giving regulatory authority over these products, and prior to that, they were just regulated as a regular tobacco product. At this time, they made it federally illegal to sell to minors, which surprisingly, prior to 2016, there was no age restriction federally for buying these products. A lot of states and localities passed their own laws previously, but there was still a decent amount of the country where those younger than 18 could purchase these products legally. In addition, they restricted use in vending machines to further prevent youth that aren't above 18 from getting access to these products. And they required that these products need to be approved to remain on the market. In addition, one of the other things the FDA ruled is that these products must submit their list of ingredients and have approval from their devices. The common ingredient seen in e-liquids is nicotine. However, there are nicotine-free solutions. And then humectants, such as propylene glycol or glycerol, these are the majority of the e-liquids are made up of these, and this is where the cloud of vapor comes from when it's heated. In addition, there's loads of flavors that are available, again, over 7,000 at one point. And then there's ethanol in some, or drinking alcohol in some of these solutions. And this is generally a very low percent, less than 2%. Some of them don't have ethanol, and some of them are added intentionally to help with a throat hit or a feeling in the back of the throat when they vape these products. We'll be going over the toxicities of nicotine at a later time, but I wanted to spend a little bit of time talking about the toxicities of the other products in these solutions. So the humectants and the flavors are commonly products that are GRAS, G-R-A-S, or generally recognized as safe. And these are products with minimal to no toxicity that are commonly used in foods and other medications. What's important about this designation is these are generally recognized as safe for oral consumption, and they're not been studied in inhalation. There are a couple concerns with this, as if a product is poorly absorbed while it's eaten, it has an exit route as it passes through the gastrointestinal system and out through the stool. Whereas if this is ingested or inhaled in the lungs and it's poorly absorbed, it's much more difficult to get this out. In addition, there may be different toxicities that are seen in lung tissue rather than if it's absorbed. And typically when something is inhaled versus eaten, it gets into the bloodstream at higher concentrations as well. In addition, the humectants have been implicated in the flavors as well. While these are heated, they may change into different products which are not the same that are in the e-liquids themselves. And so they may change and we may have different products that are being inhaled. We'll talk a little bit about this later. So in general, the long-term safety of these products is unknown. It took us decades to realize the effects of tobacco on health, and e-cigarettes have only been around about 15 years. Well, this is something that we're going to be keeping a close eye on, so hopefully we should get more data before that. But studies may be more difficult, as the primary population that's using e-cigarettes and that we're going to be studying for these long-term and small health risks is those who have also used cigarettes. And so we're well aware of the health risks involved with cigarettes, and so potentially if patients who are using e-cigarettes start developing cancers or cardiovascular risks, is this going to be due to the years that they've used e-cigarettes, or is this potentially due to the years that they were using conventional tobacco products? So in e-cigarettes, besides vapor, or besides the nicotine, the amount of potentially toxic substances is less than combustible cigarettes. And this can be dependent on use. So those humectants and flavor products, as seen earlier, they can be changed while the device is heated. And this can cause some other products, such as formaldehyde and others, that we know can be dangerous to health. A lot of the studies that have looked at this have used machines to actually vape the products and then check what's inside of that. And so some criticism to these studies is that they're, one, not consistent, and there's a lot of variability between the products themselves. And then also, when these machines are vaping the products, they may be having what's called a dry hit, and which an individual would normally stop inhaling at that point. So a dry hit may be due to too high of temperatures of the coils, and so it's heating too far and potentially burning and changing the products, as well as if the amount of liquid is lower than optimal, and this can cause, again, burning. So some people say that while these products may be formed with high heat, a lot of times people aren't inhaling at that high of heat, and they're going to either refill the device or let it cool down. In addition, there may be more metal exposure with e-cigarettes, except for cadmium, which is in very high concentrations in traditional cigarettes. But this is, again, dependent on use. So higher risk procedures would be those who do what's called dripping, where they remove the cap from generally the modded type e-cigarettes, and they can drip liquid directly on the coils and then vape the product from there. This is in contrast to typical use where the e-liquid goes through a wick and is heated without coming in contact with the coils. And so if this liquid is directly on the coils, It, one, produces a larger volume of vapor, which a lot of people enjoy doing that way, but it might be carrying some metal products into the individual themselves. So while we don't know the long-term risks, and there's very little studies on the risk of this, by looking at the composition of the vapor in comparison to conventional combustible cigarettes, we can make some assumptions about the risk. So looking at nicotine itself, normal use results in short-term increased blood pressure and heart rate. However, inadvertent exposures can result in life-threatening toxicity. Pediatrics are especially at risk due to their size, their inquisitive nature, crawling around, and if these products are available and they have a sweet smell, they can be attractive to pediatrics. Nicotine itself has not been very well linked to being a carcinogen. It's mostly we know of the tobacco and the other products in cigarettes that cause these risks. And as far as our studies know at this point, there is not a carcinogenic risk with nicotine itself. So nicotine toxicity, if someone was to get too much, typically with vaping and combustible cigarette use, as this is absorbed so quickly and only small amounts are inhaled at each time, individuals can quickly tailor their use. And if they start to feel like they've gotten the amount of nicotine they need, they stop inhaling. However, with especially pediatrics, if they ingest these liquids, while they are quickly absorbed, they're not going to feel the effects right away. And regardless, the taste alone might be something that will convince them to drink enough. So typical symptoms are going to be nausea and vomiting, tremor or fast heart rate, but these symptoms can very quickly get severe, which can cause seizures, low heart rate, and then even respiratory paralysis, so the individual stops breathing. Seen on screen here is a fairly high concentration, 6% of nicotine. This is a 30 ml container. This is about 1.8 grams of nicotine in this container, and the amount that could potentially be fatal to a child if they are not promptly treated is less than a mouthful of this product. So they're at very high risk if these products are gotten into. And again, part of the FDA regulations was to enforce that these products have child-resistant caps on them to prevent, hopefully, as many poisonings with this. In between 2012 and 2015, there was a huge increase in the amount of poisonings we saw as these products became more available. And from 2015 to 2017, as these laws went into effect for child-resistant containers, we saw about an 18% decrease in the amount of calls that were each poison center got. There's also concern for marijuana use in e-cigarettes. This is commonly known as canna-vaping. And THC oils or waxes can be dissolved into either the typical pod-based systems, so the typical jewels that someone may actually refill those pods with THC, or just large tank refill systems, such as the third generation mod type e-cigarettes. Some people use this because it's easier to conceal than dry leaf marijuana. If it's especially inside of a pod, these can be easily placed inside a plastic baggie and there's little to no odor. And typically the marijuana odor fades much quicker from vapor than it does from smoke. And so while it does still have the stereotypical odor, this could fade much quicker. And these can be obtained commercially in states where it is legal to purchase recreational marijuana, and it's often obtained on the street as well. Moving on to the vaping-related pulmonary illness, there's been hundreds of cases linked to e-cigarette use and 6 to 7 deaths that have been reported related to e-cigarettes. Investigations are still ongoing and no definitive chemical has been identified at this point. And so there's a lot of studies and a lot of resources that are going towards these investigations. In one of the largest cohorts to date, of 53 patients, THC was reported in 80% of the patients interviewed. So there's a lot of this maybe due to potential THC or other contaminant use with that. However, 17% of these individuals reported that they only use nicotine and they didn't use any THC product, leaving us unsure of where this risk is truly coming from. Patients who showed up with these symptoms are typically the same type of patients who are using e-cigarettes. So oftentimes it's young white males. The median age for this group was about 19 years old. Most of these symptoms were presented with at the time of either hospital visits, where they were admitted to the hospital, or they were seen a few days before this at an outpatient or primary clinic. And they presented with shortness of breath, cough. Quite a few had gastrointestinal symptoms, such as nausea, vomiting, or diarrhea, and many had a subjective fever. The initial labs and findings included an elevated white blood count in 87% of the patients, and then bilateral infiltrates on imaging in 100% of these patients. 94% of these patients were hospitalized. Over half of them ended up in an intensive care unit, and almost a third of them had to be intubated or had a machine breathing for them due to the severity of their lung injury. Most of these patients received antibiotics, some of them at outpatient visits a few days prior to their hospitalization, and most of them during their hospitalization. However, notably, in all of these individuals, the infectious workup was negative and there was no cause of infection found, which is one of the diagnostic criteria for associating this with vaping. 92% of the individuals had systemic steroids, and about 60% had documented in their medical records that this improved their symptoms. So kind of concluding on this vaping injury, there's been no single product or substance identified that's been associated with this. And so the recommendation is to consider not using e-cigarettes until there is more known. If e-cigarettes are going to be used, you should be especially avoiding products not associated with authorized retailers, such as those bought on the street, those with THC, and modified products. There's been some discussion about vitamin E acetate as a potential cause of this injury. And while this hasn't been universally shown, there has been a large amount of these products that are associated with the injury. Oftentimes, we might think that this is associated with contamination, and especially for those with THC, where they're not available commercially and this is bought on the street. If individuals are reselling these, they're taking the large bulk THC, putting it into pods, and then reselling it. If they're able to dilute this, then they're able to make more profit off of this. And vitamin E acetate is, one, able to fairly reasonably well dissolve the THC product. And in addition, it's a thickening agent, which can help with making some people think that their product is more pure. And so that may be where some of the links to this unregulated THC dilution products off the street comes from. So looking at the benefit to public health or the risk to public health, the effect depends on three factors: the intrinsic toxicity of the e-cigarette devices, their effect on combustible tobacco cessation, and the effects on use of combustible tobacco products. So as mentioned, the intrinsic toxicity of these devices and the e-cigarette liquids, we don't know a whole lot about them, and that's going to be a huge determination into whether these are something that's going to be beneficial for public health. The effect on combustible tobacco cessation is probably where we'll get the largest benefit for using e-cigarettes. If we can get a large amount of adult population to switch from using conventional tobacco combustible products to then these e-cigarettes, and if these turn out to be much safer, then we can have a large reduction in deaths and cost savings with the health dollars. And then their effect on youth use of combustible tobacco products as well is a huge concern. As there is such a large portion of these youths that are using e-cigarettes, the big risk is that they might then transition to combustible cigarettes later in life. And there is some evidence that's correlated with using vaping products even monthly that have been shown to increase the risks of people using combustible cigarette products later in life. So we've talked a little bit about the previous two, but smoking cessation is something that is important for the risk of public health. And e-cigarettes have been found to variably deliver similar nicotine doses as combustible cigarettes. And this is shown to increase nicotine delivery with increasing generations. As the batteries have become larger, they have better delivery of nicotine into the systemic circulation. And this is interesting because some of the first studies that were done with e-cigarettes and looking at the rates of smoking cessation used the cigalikes, so the first generation or sometimes second generation products, which have been shown to not deliver nicotine as well as the later products, and especially in contrast to conventional combustible cigarettes. Now, this might seem like a good thing of less nicotine being delivered leads to then people getting off of these cigarettes faster. But what we saw is that this just led to less use of e-cigarettes and individuals using dual use. So they use their e-cigarettes in addition to smoking combustible cigarettes, or they just stopped using their e-cigarettes and transitioned back to combustible cigarettes. So there is limited evidence that e-cigarettes may be effective to promote smoking cessation, and there's moderate evidence that nicotine e-cigarettes are more effective than non-nicotine e-cigarettes. One of the recent studies just in 2019 found that about 18% of people quit using combustible cigarettes using nicotine e-cigarettes versus only about 9% which use typical nicotine replacements such as the patch, lozenge, or gum. However, what we saw was about 80% of those who quit using tobacco products and switched to nicotine e-cigarettes were still using their nicotine e-cigarettes 1 year later, versus those who used the conventional methods of nicotine delivery, such as the transdermal patches. Many of them were completely off all nicotine products. And so it's yet to be seen what will be more beneficial of just having as many people as possible stop using combustible cigarettes and switch to e-cigarettes, or if we can try and get these individuals off of nicotine entirely. So in conclusion, e-cigarettes have become increasingly popular with children and adolescents. This may be due to some of the marketing in which the FDA is attempting to reverse these trends through regulation of both marketing and the products available, and through harm reduction programs. The long-term health outcomes are unknown, but are likely much less dangerous than combustible cigarettes, as the amount of toxic chemicals in the vapor or the smoke is much less than conventional cigarettes. There's been pulmonary illness increasingly associated with vaping, although much is still unknown, and so the consideration for not vaping is recommended until we know further. And the benefit or risk to public health depends on initiation of combustible tobacco users, cessation of old users, and the toxicities of vaping. And there's still a lot of research that needs to be done before this can be evaluated completely. And the last conclusion is that youth, pregnant females, and non-tobacco dependent adults should not use e-cigarettes. Youth and pregnant females, because we know some of the risks in brain development of adolescents and especially infants. And then non-tobacco dependent adults should not be using these, as it may increase the risk of them then switching to conventional combustible cigarettes. Attached are my references here. I'd like to thank you all for joining me today for this. We're happy to take questions at this time if you direct them at Gaylord Lopez in the chat. Our website at www.georgiapoisoncenter.org. You can find more information, and my email if you have further questions is shown on the screen here. A survey will be sent out for CE credit for those who are interested, but it also is shown here. So at this time, we'll start answering any questions.